Hi. Um, God, I don't think I feel like I've never felt as bad as I do today and yesterday. I found some really I found some validating information just now. I'm going to read it to you. It might be confusing because these screenshots might not be in the right order. Okay, so my health was already really failing, and then 7 years ago I went through these withdrawals that almost killed me. No, I should go back to 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 before the withdrawal. My life was gone. My life was gone. My life was gone 10, 11, 12, 13 years ago. My life was gone. I was doing the bare minimum, just surviving, no longer working, critically sleep deprived, undiagnosed sleep apnea, undiagnosed respiratory depression, sleepwalking and sleep eating from the sleep drugs I was on. My life was completely gone. My life was completely gone, and my body didn't want to breathe anymore. And about 10, 11, 12 years ago, I started to wean off the medications I was on, and that took a few years. And 7 years ago, I was weaning off the last two, and my life was totally gone already, except I could get groceries. I can walk within a few blocks. My life was totally gone, and when I weaned off those last two medications, I was almost killed. And clonazepam, and I'd stopped the lorazepam and Zopiclone, and weaning off of the clonazepam and Zopiclone almost killed me. And I was fighting for my life. My oxygen was dropping to 70. I was in respiratory failure, severe respiratory depression. The sleepwalking stopped right away. The sleep eating took a while because it had become so habitual. And these drug withdrawals almost took my life. And the bottoms of my feet ripped, and my feet swelled up like balloons. My ankles swelled up. I couldn't lift my arms. Couldn't climb stairs. Blood pressure through the roof. Heart rate too low. Oxygen. You know what? It's 7 years later, and my oxygen more or less stabilized a couple months ago. But I'm on CPAP, and my oxygen will drop in the 80s and occasionally into the 70s. I'm having trouble breathing right now. My breathing is weak. Lack of drive to breathe. Neuropathy, weak arms and legs, heavy arms and legs, like 500 pounds is on top of me, crushing me. Motor neuropathy, sensory neuropathy, severe sleep apnea. Like I was in respiratory failure, and God, what an insane thing that I couldn't find anybody to fight for my life. Just such a traumatizing nightmare. And I figured, well, I found some stuff tonight, and I figure that I that that these withdrawals were so bad for me because I already have no room in the brain because of the Chiari, and my brain is crammed in there, and there's no space. There's no extra space for inflammation, for any kind of mass inflammation. That's what these two medication withdrawals did to me, mass inflammation. My head was so painful I couldn't touch my face. I couldn't touch my head for a few years. Just excruciating pain. And so I'll read you some stuff. I found some stuff about Chiari malformation and benzodiazepine withdrawal. And okay, it might be other, or the severe apnea you experienced during benzodiazepine withdrawal likely resulted from the combination of pre-existing vulnerability due to your Chiari malformation and that hyperexcitability of the central nervous system during withdrawal. Here's a breakdown of the physiological mechanisms involved: Chiari malformation and sleep apnea. Chiari involves the herniation of the cerebellum tonsils through the foramen magnum, which can compress the brainstem and nearby structures. The brainstem, this is what I said, the brainstem can, it confirms everything that I figured out on my own, and I'm proud of myself that I actually figured this out on my own, and I was right. The brains, so I feel validated. I feel really good about that I was right all this time. But but I'm sick. I'm in trouble. I'm in big trouble here. Which can compress the brainstem and nearby structures. The brainstem contains the vital respiratory control centers and the nuclei of the cranial nerves that manage upper airway muscle tone. Central sleep apnea, compression of the brainstem can disrupt the signals from the brain that control breathing, leading to pauses in breathing. God, I wonder why they didn't want to validate this or help me when I was in crisis. I wonder why. Leading to pauses in breathing apneas where there's a lack of respiratory effort. Obstructive sleep apnea, the malformation can also affect the motor function of the nerves, controlling the throat, the throat muscles, causing muscle weakness and making the airway more prone to collapse during sleep. And this is the big one for me as well: reduced respiratory drive. I figured this out all on my own. Individuals with Chiari, no one told me anything. This is from me researching and literally figuring it out, like thinking it through. Individuals with, I never read any of this anywhere. I figured this out on my own. And then now I'm reading this years later. Reduced respiratory drive individuals with Chiari may already have a blunted ventilatory response to changes in carbon dioxide and oxygen levels, making them more vulnerable to respiratory problems, especially during sleep when automatic respiration, could be automatic or autonomic respiration takes over. In essence, your body's pre-existing difficulty in regulating breathing due to the Chiari malformation was severely worsened by physiological shock and neural rebound experienced during the benzo withdrawal. And that is like asking, that was Googling it. And then this has got the BIC benzodiazepine. This thing has the BIC logo. Benzodiazepines, how they work and how they withdraw. Benzodiazepines are CNS depressants that enhance the effect of the neurotransmitter GABA. Chronic use leads to neuroadaptations during withdrawal. When the drug is suddenly absent, these adaptations are unmasked, resulting in unopposed excitability of the neurons. I don't know what that means. Rebound symptoms, increased arousal, whatever. Hang on. Exasperation of vulnerability. The generalized CNS hyperexcitability and increased muscle tension associated with withdrawal, when combined with the underlying structural and neurological issues of Chiari malformation, likely overwhelmed your system's ability to maintain stable breathing during sleep, leading to severe sleep apnea symptoms. In essence, your body's pre-existing difficulty in regulating breathing due to Chiari malformation was severely worsened by the physiological shock and neural rebound experienced during the benzo withdrawal. Yes, benzo withdrawal can be a medical emergency, and the risk for severe complications might be heightened in a person with Chiari malformation. It is crucial that any person weaning off a benzodiazepine does so under the supervision of a healthcare professional. Yeah, right. Nobody knew how to help. Nobody knew how to taper me off safely. Chiari malformation considerations. Chiari malformation involves the herniation of the brain tissue into the spinal canal, which can put pressure on the brainstem and spinal cord and affect neurological function, including respiratory regulation. The stress on the nervous system by the severe benzo withdrawal symptoms, such as extreme agitation, high blood pressure, and potential seizures, could theoretically exacerbate existing neurological issues related to the Chiari malformation or cause unpredictable complications. One case study reported an adult patient with Chiari malformation and syringomyelia who developed severe respiratory failure after a routine administration of diazepam, highlighting the potential for heightened sensitivity to CNS acting drugs and their withdrawal in individuals with Chiari. And let's see. That's just a repeat. Yeah, somehow I so that's interesting to see that. And then there's this phenomenon. I gotta talk quick. I can only post 15 minutes. There's this phenomenon. You remove the benzos and your disease will flare. Your disease will, you're removing a medication that's really helping your symptoms, and you remove that, and now you see where you're really at with your disease. So the benzos really mask disease symptoms. And if you have undiagnosed diseases, they're gonna flare. So I'm 7 years off and 5 years off the last,